Good afternoon, everyone. I would like to take this opportunity to thank the conference organizers for allowing me the opportunity to speak to you today on behalf of my colleagues in Nairobi and Manitoba. According to UNAIDS, approximately 38 million people worldwide are currently living with HIV, with Eastern and Southern Africa bearing over 60% of this burden. As we look towards ending the AIDS pandemic by 2030, public health interventions will increasingly focus on key populations at greater risk of HIV. For a time, it was assumed that, aside from vertical transmission, the HIV epidemic in Africa was entirely heterosexual in nature. While significant heterosexual transmission was supported by epidemiological studies, the HIV epidemic in African men who have sex with men, or MSM, was largely ignored until the last 10 to 15 years. MSM who sell sex to other men are especially vulnerable to HIV compared to MSM who do not sell sex. Studies from Kenya estimate HIV prevalence in MSM sex workers between 26% and 40%, which is significantly higher than what has been reported for female sex workers, or FSW, at 30%, and people who inject drugs, or PWID, at 18%. MSM sex workers also frequently report sex with women, both paid and unpaid. There are even some reports that MSM sex workers and FSW may be sharing clients at local hotspots, suggesting an important role in shaping the wider HIV epidemic. Even though it is quite clear the burden of HIV among MSM sex workers is high, there is a considerable degree of uncertainty surrounding the dynamics of transmission in this population. One approach to understanding transmission dynamics stems from phylogenetic analyses that take advantage of the constant rate of HIV evolution, and a handful of papers have explored this approach to understand HIV transmission dynamics between MSM and heterosexual populations in Kenya. For example, the HIV phylogenies on the left-hand side represent clustering patterns of different key populations in coastal Kenya from a recent study by George Anduva et al. The authors concluded that most phylogenetic clusters were made up of sequences from the same key population. Therefore, transmission mainly occurs within rather than between key populations. However, it would be important to interpret these findings with cautions, since studies like these may be biased due to poor sampling and/or rely on sequences from databases that typically lack socio-demographic and behavioral data. The Sex Worker Outreach Program, or SWOP, is a decades-long collaboration between the Universities of Manitoba and Nairobi, which is supported by US PEPFAR. SWOP is a network of 7 sex worker-dedicated clinics providing STI and HIV testing, treatment, and care across Nairobi County. SWOP clinics underwent a massive scale-up, which is represented by the bar graph on the top left, from 419 FSWs enrolled in 2008 to over 30,000 ever enrolled by the end of 2017. A recent study by Achang-Tago and colleagues suggests that over the past decade, HIV prevalence at enrollment decreased in FSWs in all age categories from 40% in 2008 down to 12.3% in 2017, which is represented here by the bar graph on the bottom left. To develop, implement, and maintain an effective HIV prevention and treatment program, SWOP requires a comprehensive understanding of its clients. Today, I will be focusing on the SWOP City Clinic, located within the Central Business District, or CBD, of Nairobi. This particular SWOP clinic is located within the highest density of sex worker hotspots in comparison to other SWOP clinics. The main objective for this study was to understand HIV transmission dynamics by inferring HIV phylogenetic clusters among MSM and FSW accessing SWOP City, Nairobi. To do this, we consecutively sampled all MSM and FSW living with HIV attending SWOP City for routine viral load monitoring between 2016 and 2019. Sociodemographic and behavioral data was collected from each participant using a structured questionnaire. However, this data will not be presented here today due to ongoing data analysis. A portion of the HIV poll gene was sequenced using a MiSeq platform. This approach is currently being used to determine strain and drug resistance patterns in Canada by the National HIV and Retrovirology Laboratory of the Public Health Agency of Canada. Phylogenetic analysis was undertaken using a maximum likelihood framework with the latest version of IQ-Tree software. Clusters were identified using a patristic distance of 0.02 nucleotide substitutions per site or less, and with cluster picker software with a 70% bootstrap support and a genetic distance cutoff of 4.5% or less, both of which were measured on phylogenetic trees. We used two different clustering methods as a form of sensitivity analysis since no gold standard approach currently exists. The existence of a cluster was interpreted as evidence of more closely related infections, suggesting a common source of infection and not as evidence of direct transmission. Effective population size estimates were inferred using a Bayesian MCMC analysis using Beast version 1 software. This analysis was limited to subtype A1 sequences from this study. Between 2016 and 2019, we collected 857 unique blood specimens, of which 80% were from FSW and 20% from MSM. We generated 498 unique HIV poll sequences, of which 80% were from FSW and 20% from MSM. We suspect that the low sequencing success of approximately 60% was due to high coverage of ART among participants. Using patristic distance, we identified 34 clusters ranging from 2 to 5 sequences in size. Among these clusters, 15% were FSW exclusive, 15% were MSM exclusive, and 70% were mixed. These clusters are visualized here on the left-hand side, and each node was annotated according to key population, FSW in purple, MSM in yellow, and database sequences in blue. Overall, 23% and 60% of FSW and MSM sequences clustered respectively. Likewise, we identified 78 phylogenetic clusters ranging from 2 to 7 sequences in size with Cluster Picker. Among these clusters, 19.2% were FSW exclusive, 2.6% were MSM exclusive, and 78.2% were mixed. The corresponding HIV phylogeny is visualized here, where clustered sequences are identified using different colors, while unclustered sequences are in black. Using this clustering method, we also found that approximately 23% and 71% of FSW and MSM sequences clustered respectively. The Bayesian skyline plots you see here indicate that the number of FSW contributing to new HIV infections, expressed in terms of effective population size, increased from 2005 to 2012, while the number of MSM contributing to new HIV infections increased from 2005 to 2010. The number of sex workers contributing to new HIV infections did not appear to increase beyond 2012. Important HIV interventions, such as SWOP, changes in CD4 thresholds for ART initiation, HIV viral load monitoring, and treatment as prevention or TASP, are also overlaid onto these plots. To put these changes in population dynamics into context, we noted that the mean duration of sex work is 6.2 years, indicating that a significant proportion of sex workers would have been living with HIV during the early 2000s prior to entering sex work. Time to initiation of ART from 2008 to 2011 was approximately 3 years, and coverage was approximately 25% during this time period. ART coverage increased from 40% in 2012 to 90% in 2017. Taken altogether, the introduction of these interventions could explain in part why the effective population size ceased to increase at a certain point in time. Also, recent reports have indicated that HIV incidence is on the rise due to service disruptions stemming from the COVID-19 pandemic. Biological specimen collection has resumed, and this analysis will be updated in the near future. To conclude, approximately 1/5 to 1/3 of all FSW and MSM sequences link to at least one other individual, suggesting a significant overlap between transmission networks. The phylodynamic analysis indicates a sharp increase in the epidemic from 2005 to 2012, which highlights critical periods of HIV vulnerabilities. For example, studies from Mombasa, Kenya, suggest that adolescent girls and young women who frequent sex worker hotspots experience high rates of HIV-associated vulnerabilities prior to self-identifying as sex workers. Phylogenetic analysis could therefore potentially identify profiles of higher vulnerability of HIV transmission, which could assist in strategic, targeted, and timely interventions to decrease HIV risks. With that, I would like to acknowledge all the participants who took part in the surveys for their time and participation, the hardworking folks at SWOP PHDA, the Universities of Nairobi and Manitoba, and especially my committee members, Lyle, Marissa, Surde, and Paul, for their steadfast support. Also, I'd like to acknowledge my colleagues at the National Microbiology Laboratory. Thank you. Merci.